We will be performing an evacuated tube system method, single draw. First thing to do is to check the requisition form and introduce yourself to the patient. Next is to correctly identify the patient's name. After verifying, position the patient in the phlebotomy chair. For the materials, you will need an adapter, a two-way needle, an evacuated tube, an alcohol pad, and cotton. Apply the tourniquet approximately 2 to 3 inches above the antecubital fossa. Locate the best vein of the patient using the index finger of your non-dominant hand. In this case, we selected the median cubital vein. Then, cleanse the venipuncture area using an alcohol pad and work in a widening concentric circles. While letting the area to be air dried, assemble the two-way needle and the adapter. Reapply the tourniquet. Be sure to examine the needle for any defects. Then, anchor the vein below or above the insertion site and place the bevel up at an angle of 15 to 30 degrees and insert the needle. Put the evacuated tube inside the adapter and gently push it. When blood is flowing through the tube, remove the tourniquet and wait for the tube to be filled. Then, carefully remove the evacuated tube. Place a cotton at the site and immediately put pressure after removing the needle. Properly dispose the needle in a sharps container. Again, re-identify the patient and label the tube with his or her information along with the time and date of collection. Dispose the other trash in a yellow bag or container. Again, recheck the patient's arm and properly put a bandage on the site. Clean your workstation and reorganize your equipment.
So for today, we're going to learn how to do the dermal capillary puncture, the basic and the most easiest puncture technique used for blood sample collection. Before making this laboratory procedure, every phlebotomist must wear complete personal protective equipment or PPE. To begin the procedure, you can introduce yourself to the patient and the procedure that is about to do to him or her. Assemble the necessary equipment. The materials used in this method are feather lancet, capillary tubes, alcohol pads, cotton balls, and a micropore. Select the proper puncture site in the patient's one of two non-dominant fingers in his non-dominant hand. Warm the puncture site to add pressure to the flow of blood in the finger. Point down the finger to puncture and cleanse the fingertip with alcohol pad in circular motion. Take your feather lancet. To open it up, put it up against the light to see where the pointed tip. In puncturing, be aware not to stick center or medial in our patient's finger, but we should go to the lateral side or perpendicular to the fingerprint. Take the patient's finger and squeeze it, then push in the lancet. Wipe away the first drop of blood with cotton balls. With your capillary tube, red line facing down, go ahead and dab it to the blood bubble and collect the sample. Try not to touch the capillary tube to the patient's skin. Do this until your capillary tube is full. The most ideal collected sample is 3/4 of the capillary. While waiting for your tubes to be full, you can talk to your patients and ask them if they're still okay. When the tube is already full, place it beside you. Place a cotton ball in the punctured side and ask the patient to hold it for a while. Discard the collection devices that was used based on OSHA guidelines in disposal of equipments. Recheck the puncture and apply a bandage on the area. Clean the work area and reorganize your equipments.